It's my great pleasure to introduce a friend and a colleague, Dr. Chuck Scales. He is going to talk to us today about his efforts and what he's learned about diversity and equity and inclusion and being an ally in the field of urology. Dr. Scales is an associate professor at Duke University. He is in the Department of Urology. They will become a Department of Urology July 1 this year. So he's already listed Department of Urology there, but he's also in the Department of Population Health Science. And he has done a lot of research in the area of big data, if you will, health services research, some of which has focused on disparities and differential outcomes. And a lot of his research, most of it is on stones. And I know Chuck as a stone urologist. He's a member of the Rock Society and kind of runs in those same circles. Importantly, Dr. Scales is also the director of the Surgical Center for Outcomes and Equity in Surgery at Duke University. And this is a university-wide initiative. And I think the fact that Dr. Scales has been asked to direct that is a testament to his interest and burgeoning experience in this area. He has a lot of grant funding. He is the coordinating center or serves as the director of the coordinating center. I think it's a U24, isn't it, Chuck?
Yes, we're now at U24, started as U01.
Yeah.
Iteration U24.
So he's the U24 or coordinating center for what we were talking about just a minute ago, the USDRN, which is the Stone Disease Research Network, Urinary Stone Disease Research Network. And they're involved in two very large scale studies, one about stents, the dreaded stent that people get after stone surgeries, and the other is on fluid intake as a preventive for stones. So there's many more things I could say about Dr. Scales, but I think I'm going to not take up any more time. I'm very happy to see some of the UW-Madison Spur scholars here. Dr. Vazina and I got an R25 program for undergraduate summer research in urology. Awesome. And I see some of these students on the call. Really glad you made it, and happy that all others have joined the call as well. So I'm going to let Dr. Scales take it from here, and we'll try to hold questions and discussion until the end of his talk, but feel free to use the chat in the meantime.
Absolutely. Well, thank you very much, Dr. Pennison, for that incredibly kind introduction. I'm very excited to be here today and chat with the CAIRIBU group. I'm going to talk about DEI, as the title implies, as well as focusing really on allyship and some of the techniques that can be used to promote allyship. I'm also going to share some of the data of demographics in urology and some of the data around what some of the biases are that have been measured in urology, just briefly. So, and again, please feel free to put comments in the chat, and I will definitely keep an eye on that as we go through. So very briefly, so why have I become a big proponent of allyship and interested in this space? I've been on faculty at Duke since 2011, or excuse me, since 2013. And in 2016 to 2018, I really developed a mentorship focus for my work. I had a lot of very fortunate early success in research. And I was very focused on mentoring, and I, began to, as I've always believed, it's really important to listen as a mentor. And so I listened to a lot of my mentees' stories, and really became much more aware of the impact that unconscious or implicit bias has in the workplace. And so in 2018, I attended a workshop on unconscious and implicit bias at Duke University. And it was really compelling for me. And I realized there was a real need there for me as a white cis male to get involved and to learn how to more effectively engage to really break down some of the barriers that a lot of my mentees were facing. So I underwent, in 2019, I underwent formal training in terms of to become in other words, how do you a training to mitigate unconscious bias, and then I trained as a facilitator for unconscious bias discussions within Duke Surgery. So I became, at the end of this training, part of a team where we went through the entire Department of Surgery and did training with staff, residents, and faculty, over 800 people. In 2019 to 2021 as a facilitator for these discussions, and talked about the impact of implicit bias and how to mitigate that impact in our workplace at Duke Surgery. In 2022, so some of those efforts morphed And we're now focusing on allyship and equity efforts within Duke Surgery. I've been helping to redesign some of the recruitment processes for Duke Surgery in terms of at least initially faculty, and then concentrating on residents as well as staff, and how do we create a more equitable workplace there at Duke Surgery. So that's been my journey. And I think, if you ask me why is this important to me personally, as well as organizationally, I think number one, it's just the right thing to do. I think, I don't know that really needs to be expanded upon, hopefully. So I think it's really important in medicine that we reflect the diversity of the community that we serve. Certainly in Durham, there's a very large Black American population, and certainly we do not, fully reflect that across most of the surgical divisions, including urology at Duke Surgery. So I think the other thing that's really important to consider is that healthcare is full of complex problems. As is laid out very nicely by Scott Page in this book here, The Diversity Bonus, diverse teams that have a wide variety of life experiences and perspectives are actually better at solving complex problems. And so I think that's a really key point here, is that many industries are complex, but I would say healthcare is perhaps one of the most complex industries in terms of the challenges that we face, the high stakes of what we try to do for patients, and the need to both treat patients, but also educate them and care for them in a very compassionate way to lead them to better health. And I think that is a really critical part of why diversity, inclusion, and equity are very important in our workforce. And then I think the other thing that's really important to consider is that we have the demographics in the United States are such that we simultaneously have a very rapidly aging workforce and a very rapidly aging patient population. That means that because of the baby boomer generation, the patient population is going up dramatically. And I have a whole other talk about how essentially 10,000 people in the United States turn 65 every day. And that's going to be a huge demographic tidal wave that we're going to be trying to care for as urologists, because of the very high prevalence of urologic conditions in older adults. Simultaneously, we're going to have a lot of practicing urologists retire, and we need to make sure that we have a work environment that is inclusive and really promotes the sense of belonging for people from all backgrounds in the United States in order to care for this population. So what are the demographics of practicing urologists today? So these are some data from the AUA census, and the source there is on the slide. So the total number of practicing urologists and the percentage of women practicing urologists in the workforce. So the total number of practicing urologists are in blue, and you can see the percentages there. So back in 2014, women urologists were about just under 8%. They've grown to 11.6%, but still very clearly a very small proportion of urologists in the country. This, as you probably is probably not surprising, the percentage of female urologists is about 25% for young urologists less than 45 years of age, and it declines quite rapidly, and is less than 1% of those that are over 65. So just a sense of what the male-female demographics are. In terms of ethnicity, here we see the number of Hispanic practicing urologists in blue, and the percentage of overall urologists in green again. And what we see here is 2014, about 4%, really not very much growth here. In 2022, a decade later, only 4.9%. And here we see the same breakout for African-American or Black urologists in the workforce, and it has kind of ranged from 275 to 293, so a little over 300 in 2021. This is all by, these are weighted samples and by self-report. But again, our percentage of individuals who identify as African-American or Black is very small, and hovers between 2.5% to 2.2%, depending on the year and the data. So it's a really, I think, a critical need in our field. And I think that many people may be aware, there are certain diseases such as prostate cancer, which are both more prevalent and have a higher mortality in the Black American population. And so I think it's even more critical that we engage individuals that reflect those risks and those demographics. So this is a really interesting study, and there's been a few done in this field, but this one is across all urologists. Is essentially this was a survey done of urologists through the AUA, and essentially it was querying them on their perceptions of gender equity. The survey itself that was administered is called the Culture Conducive to Women's Academic Success, or CCWAS. And the higher the score that the individual responds, the greater they perceive equity in the work environment. And so everyone basically responds about what their perception is of the equitable features of their work environment. There was about 35% of individuals of the respondents were female here. And what the investigators saw was that there was a very clear difference where males viewed the work environment as much more equitable than females in the same work environments. And as you see here, basically, there was a substantial difference, especially between the men as well, in particular by seniority as well. And so basically, it's a real thing. And I think there are a lot of folks that look a lot like me who don't necessarily completely understand what's going on. So, or maybe don't have a full perception of what's going on. So, the good news is that urology as a field is aware that there's a problem, and there are definitely some nice efforts that have arisen in the past 24 months to focus on this. Some examples of this are talks like I'm giving today, of course. Urology, the journal, the Gold Journal, has created a diversity and inclusion focus issue that I believe is going to be an annual issue now. And they also have some special areas on that, and editors focused on that. The AUA News has a diversity focused issue, and in March this year they had a women's issue for Women's Health Month, or excuse me, for and then the Journal of Urology also has established the Health Equity and Diversity, or HEAD table, which is a group of editors that are specifically from a diverse set of backgrounds and focused on making sure that articles around health equity reach the Journal of Urology audience. The AUA has established a diversity, equity, and inclusion committee, and they've had a number of recommendations they've made to the board, which the board has endorsed, and will be starting up work in those areas soon. The Indo-Urology Society, which Dr. Pennis and I are both part of, has a diversity and inclusion webinar on a quarterly basis, and they also have a speaker and committee portal. And I think this is a nice intervention for equity. Oftentimes, it's the case that speakers are chosen by who you know, and who you know has expertise in an area. But that unfortunately tends to reinforce the existing networks that are out there in our field, which, as the demographics would suggest, tend to be largely white and male. And so one way to combat that is that was what the Indo Society has done, which has an opportunity for individuals to volunteer and say, hey, I would like to speak at a conference, and here are the topics that I can speak about. And likewise, if you're interested in being on a committee, you can volunteer to be on a committee. And so that really just expands the network and the pool of individuals who are able to self-indicate. I think the issue of manels is something that also people are quite familiar with. If you're not familiar with the term, it's a panel with only male members. The Society for Women in Urology, or SWU, has created a speaker database which allows a convenient way to identify women. So again, if you don't have as many women in your network as you should, or you're seeking people who will be able to speak on a specific topic, you can go to the speaker database and find out who's out there that, again, might be outside of your network to really expand that. So I think there's some good initiatives that have started up in urology, and I think there are more to come from the AUA. And so I think that I'm optimistic that we'll begin to make some progress in this area over the next few years. So maybe we should start with what is allyship. So as it turns out, in 2021, allyship was the word of the year as decided by dictionary.com. And what allyship is defined there is that it's the status or role of a person who advocates and actively works for the inclusion of a marginalized or politicized group in all areas of society, not as a member of that group, but in solidarity with the group's struggle and point of view, and importantly, under its leadership. So these aren't activities done independently, but really in partnership with the disadvantaged groups that you're trying to ally with. So if you ask me why I think it's important that to be an ally and have allyship, this is what I think. I think that a just culture should not impose the burden of demolishing the bias structures on individuals that are most disadvantaged by the biases. And I would say, by and large, this is what most of our culture in the United States does, and most of our, not just sort of political culture across the country, but also a lot of our work cultures. And you see that there's a lot of expectation that individuals who are from disadvantaged populations are leading the charge in correcting those disadvantages. And I think that probably does not reflect a just culture. I think that we all should be involved in that and really break down these barriers. So I'd like to spend a little bit of time about how to practice allyship. We're going to start with self-reflection. We're going to talk about listening. And then at the end, I'm going to talk about some ways to take action as well as to learn more. So in terms of self-reflection, I think one of the most important things you can do is to take an implicit association test. And I'll give the website in a minute. But this is a test that has been created by investigators that will help you understand what your own implicit biases are. So implicit biases are things that are unconscious. They're probably maybe best described as a reaction, and oftentimes that reaction may be counter to what your strongly held beliefs are. And so we'll show that in a second. I would also encourage folks to do a network and mentorship biopsy and then do some learning and reading. Learning from the lived experiences of members of marginalized groups is really important. Then we're going to talk about bias-centered intervention, sponsorship, and then being an upstander, and then system and structure change. So the important thing about the first step here, and this is one of the first steps I took as well, is understanding that unconscious bias impacts everyone. Everyone has unconscious biases. These are formed early in childhood, and they then propagate over your lifetime. And as I mentioned, the implicit association test can help you understand your own biases. So an unconscious bias is a preference, a feeling, either positive or negative. It's some sort of an automated processing function. And these behaviors, as I mentioned, these may run counter to your consciously held beliefs. And 100% of people, everyone here on this webinar, and then everyone else you run into, we all have unconscious biases. Those can be positive or negative. Oftentimes they can just manifest as stereotypes. Sometimes they manifest as prejudices, and sometimes they manifest as discrimination. They can begin forming at a young age, as young as 6 years old, and they get reinforced through social settings and mass media. Right, so I have the benefit of, in addition to being male and white, I'm 6'4", so I'm a big guy, and there are definitely some biases towards perceiving taller individuals as more likely to be leaders, for example. There are a lot of biases out there about gender roles in science or gender roles in the family or career. And so those are things that are out there, and that we should work actively to counter those. And this is, again, it may even be, these biases can be counter to what you consciously believe, right? So you may consciously believe that women should have equal roles in science as males do. And you're very supportive and you are mentoring women scientists. And yet there may be an unconscious bias you have that's sort of automated processing, that you have a slight bias or a slight preference towards males in science. And so this IAT can actually help you reveal that to yourself. And then that allows you to understand where your unconscious biases are and then take steps to counteract that. And so these are just a short example or a short list of several of the implicit association tests they have. The address there is listed on the slide. And if you just Google implicit association test, you'll find this website in one of the top hits. It's free to do, and I would encourage you to take a few different ones of these. And as you can see, there's a lot of interesting areas, and I think you'll learn a lot. And I think it's important to take these repeatedly over time, just so you can see how you're changing or how your unconscious biases can be shaped. So, so something really interesting, and I think you'll learn something about yourself. I certainly did. I think it's the next important step for self-reflection is to do a network or mentorship biopsy. So to think back to yourself, what are the demographics of your mentees of the past 10 years? I know there's some folks here that are very early in their career trajectory in science. And so, looking around your own network of peers is another great way to sort of address this question. Your networks at the end of the day are going to shape the characteristics of your collaborators. And ultimately, when you do get into mentor roles, they're going to shape the characteristics of your mentors. And so once you do this network or mentorship biopsy, then you can think about, okay, well, what are the processes that can help you to connect with potential mentees that are maybe, let's say, outside your comfort zone? Or are there processes or patterns at your institution that either facilitate or inhibit engagement with mentees from the specific disadvantaged groups? And so this is a particularly important way that we can be intentional about who we engage with and how we can be a good ally, because engaging with individuals and mentoring individuals from disadvantaged groups is an important way to be an ally. So this is my mentee network. Over the past decade, I've mentored all of these individuals. Some of them are active in relationships. A couple of these individuals are actually part of the CAIRIBU network through K-12 programs at their local institutions. And to save you from doing the math, 2/3 of these individuals are from backgrounds that are underrepresented or in NIH defined backgrounds that are underrepresented in biomedical sciences. And so I think that's something that's really important, and that's something I really focus on in terms of my mentorship work. Here's some important resources that you can see or seek out. Some of these are targeted for specific populations or advocating for specific populations. There's the Inclusive Leaders Playbook, which is generic, and it's really important to do some reading and learn for yourself. I think that's really not particularly appropriate to go and ask people about what their personal experiences are necessarily as your source of learning. Although I will say that it's important to listen to these lived experiences when they are actually offered to you. And I think the other way to learn is to be a careful observer of interactions in your work environment. So there's a phenomenon that has been around for a long time. I think many of the females in the group will recognize this from their own lived experiences. I recently learned the term. There's actually a term of art that someone has coined. Don't know who, but heap eating is the term here. And this phenomenon is when a woman in a work environment offers up a suggestion or an idea, and it's not particularly well acknowledged in the group, and the group moves on to conversation, and then 3 or 4 minutes later, a male offers up the same exact idea, and everyone says, "Oh, that's great, John," and they sort of glom onto that. And so that is a experience that, unfortunately, I think I suspect all the females in the group here have experienced this before, and it's something that's really important to know is out there in the world. And so I think this is one example of a lived experience that if you're observant or if you listen to your peers or your mentees when they offer up their own experiences, that you can learn how things are. And then, there's a great way to address this, which is basically to say, John, thanks for that. Sally's mentioned that just a few minutes ago. And so, really appreciate her bringing that idea up. So there are ways you can then sort of intervene in the group to make sure that credit is awarded where it's actually due. One of my inspirations is actually a local person who is originally from Durham. She's deceased at this point, but she was an incredible historic figure. Polly Murray was a human rights activist, a legal scholar, a feminist, an Episcopal priest, a multiracial individual who identified as Black, and is also a member of the LGBTQ plus community. And on this is a picture of a mural that's actually less than a block from my office in downtown Durham. And I really take heart to this saying. I believe that true community is based upon equality, mutuality, and reciprocity. It affirms the richness of individual diversity, as well as the common ties that bind us together. And so I think this is another really important reason why we need to be allies, and we need to try to work towards a more inclusive and just culture. So let's talk about bystander interventions. So bystander interventions are, in essence, speaking up when you witness bias or harassment in the workplace. And this can be either conscious acts of bias or harassment or unconscious acts of bias or harassment. Sometimes people just say things and it doesn't come out the right way, and they realize immediately that they messed up. Or other times they don't realize it at all, and what they're saying is particularly harmful, is potentially harmful for individuals. Sometimes we see this in healthcare as well, when patients reveal their own unconscious biases by, for example, asking a female doctor to go to take away their tray that they finished up eating, because they confuse the female doctor or a person of color with the dietary staff, as opposed to part of their healthcare team and a physician. So bystander interventions tend to be, I would classify those as reactive. So something happens and then you respond. But it's not easy to do a bystander intervention necessarily. I will tell you, as an introvert, until I had training in this, I was very uncomfortable doing bystander interventions and not knowing the right way to speak up. I'm more comfortable, but certainly I would not characterize myself as completely comfortable in these kind of things, just because I am an introvert, as much public speaking as I do. So what are the reasons that some bystanders may not want to intervene? So maybe they don't know enough context. Maybe they're not prepared in terms of how do you respond? What are your techniques for responding? How do you intervene in a situation to protect someone? You might fear making the situation worse. Maybe no one else around is responding, so you kind of feel like maybe you're not supposed to respond either. And there could be risks of responding, of intervening. So depending on the situation, if it's out in public and an individual is being harassed or attacked, you could fear for your personal safety. In a work environment, there could be professional risks. I think it's really important to understand, though, that these situations where either conscious or unconscious biases will reveal themselves in remarks or behaviors towards members of marginalized groups, these are going to occur. 100%, they will occur in your workplace and in your lifetime. And so the question is not will I or will I won't be a bystander will I or will I be able to do it? Will I or will I not be able to do a bystander intervention? The reality is that I think we should all be prepared and learn how to do this in such a way that when it happens, we are prepared and we do know how to respond. And so I'm going to talk a little bit about how some of the techniques here. I'll say up front, this is not full training being a bystander intervention, but just to show you that there are in fact techniques and strategies to do this. And I'm going to give you some resources to go and identify these resources and get this training online, or sometimes your institutions will offer these as well. So one of the key things is, you have to make an assessment of is this the right time to make a bystander intervention? And so you need to assess the situation and your personal and professional safety, as well as the personal and professional safety of the individual that may be being attacked or harassed. You want to consider your personality and your concerns about intervening. As I mentioned, I'm a real introvert, and sometimes speaking up in public unless I've sort of thought well ahead about what I might say in the situation, is not really comfortable for me, and I don't feel like I respond immediately well in the moment sometimes. And so for that reason, I've kind of thought about, okay, well, if this is the scenario, then these are the things that I should say. And so I think that's really an important way to think about that. And then again, what are your concerns about intervening? And then there's a framework called the 5 Ds, and you need to decide which of those 5 Ds might work best in the specific context or the moment that you're confronted with. So we're going to go through these 5 Ds. So the 5 Ds of bystander intervention, there's direct, distract, delay, delegate, and document. And so direct refers to basically being directly intervening in the situation. Excuse me. Or speaking up about the harm. So, for example, I gave the I gave the example of of a female resident or a female physician being asked to clear a tray by a patient. And if you're in the room, you can say, actually, that's not Dr. Jones's job, and we can certainly have someone come by, but Dr. Jones is part of your care team. And so something along those lines. Sometimes having direct intervention is not feasible. Even people that I know that are department chairs or in positions of leadership might be in a situation where they don't feel comfortable speaking up at the moment, or maybe they don't feel like they're the right person to speak up. And so in that case, you can either delegate. So that means getting help from someone else. So perhaps you have someone else intervene. A lot of institutions, including Duke, have a what they call a cup of coffee intervention, which means that someone did something that wasn't quite right or inappropriate, and instead of having a confrontation in the moment, there's a designated person that says, hey, John, let's have a cup of coffee and talk, and let's grab a cup of coffee, and they kind of say that the other day this happened. And I think other people might have been bothered by how that came across, and let's talk about that. And so it's not necessarily punitive. It's really just more to create awareness for the individual that that's something that happened, and that's one way you might get help from someone else, and have it formal channels for that. The other thing is delay. So there's such a thing as a delayed bystander intervention. And so the two components that are really important for a delayed bystander intervention is, number one, to check in with the person who was potentially harmed, right? So oftentimes an individual is a target of a comment or a remark, be that intentional or unintentional, and you want to check in with that person just to make sure they're okay, and that they have some autonomy and agency in what happens next. Sometimes that's not easy to do in the moment, and so maybe it's something that you do in a delayed fashion. The other thing that should be done is there should be, again, some intervention with the individual who was the transgressor here, and oftentimes that is most effective on a delayed basis, where there's time for reflection and not as much not as much risk for escalation of the event, depending on what the specific situation is here. Again, the key thing with the training is you go through different scenarios and you practice this. You think ahead about what you might say, and again, context really matters here as to which of these techniques you might engage with. And it's not that it's only one; it maybe you use more than one in a given situation, a given timing. So, but as an introvert, I'll tell you that. When I learned about a delayed bystander intervention, I got much more comfortable, essentially starting out with these kind of bystander interventions, because I was able to understand how to engage with someone in a less public forum, which was more comfortable for me. And it's not only about my own comfort, but it's really about how I can be effective. And as I've become more comfortable doing these bystander interventions, I'm much more comfortable now having a direct intervention, again, depending on the context. So distraction. So sometimes an indirect approach is really just to de-escalate the situation. And so that can be engaging with the person who was potentially harmed to completely change the topic, or do something else to create a distraction and move the situation along to a different context. And again, you would want to then go back and circle back and maybe have a delayed intervention on top of that, or in combination with that. But sometimes distraction is the best way to de-escalate a situation. And then it's very important to make notes of what happened. So there is a record there. But equally important is to talk to the person who experienced the harm or the potential harm about what their preferences are for reporting. All of our institutions have formal channels for making reports about biased and harassing behaviors. But it's really important to make sure that that person who actually experienced the harm is engaged and, again, has autonomy and agency in this decision. And with their permission, sometimes you maybe want to engage your institutional reporting mechanisms. So that's a particularly important thing to consider. But documentation is important. And even if you don't plan on doing anything with it at the moment, I would say that making notes of what has happened time, date, et cetera, who was involved and who was present is really important, because sometimes these behaviors evidence as patterns over time. And without that documentation of what happened, even if it's not reported in the moment, can be really, really key. So bystander intervention, as I mentioned, may be offered by your local institution. Right2be.org has a lot of bystander intervention training resources. It's available online and free. They also have this book available called I've Got Your Back. And again, it provides a lot of resources for that. So I mentioned that bystander interventions are, I would classify them as reactive, right? Something happens and then you respond or react. But I would say it's also equally important to be an upstander. And an upstander is defined as an individual who has privilege or power that works to undo systems and or structures in our workplace or other areas that have inherent biases. And this is an individual who speaks or acts on behalf of someone else, especially when that person is being ignored or attacked. So really, this is proactive as opposed to reactive. And so, there are some things we'll talk about in a second that'll be examples of how one might be an upstander in a work environment. I mentioned earlier that mentorship is really important. And so mentorship in many ways is defined as providing advice and support. You act as a sounding board, but sometimes it can be a very passive relationship. So it depends in many instances on the mentee to approach the mentor and really be specific about what they need for that relationship. I would encourage that those of you that are in academic areas that are either mentors now or aspiring to be mentors, to think about really becoming a sponsor along with this. And a sponsor is an individual that uses his or her privilege and position to advocate for someone for an underrepresented group. And your job here is really to open doors and create opportunities. And you can really be both. And I think that's the ideal. Every mentor should also be a sponsor and should really be opening doors and creating opportunities for those individuals who with whom they have a mentoring relationship. So briefly, a little about structural bias as we wrap up here. So structural bias are institutional patterns and practices that confer advantage to some individuals and disadvantage to others based on their identities. And so I think hopefully people are familiar with structural biases. But I think they're really important. You can think of things such as parental leave policies that may be unequal for specific genders or may otherwise disadvantage individuals that are childbearing, for example, or child rearing. The other thing that is important is to think about the culture and processes of and how your culture and processes in your workplace may impact marginalized groups. So I know a common example that I think of is what are your meeting cultures? Are your meetings commonly ones where people just speak out, or as my daughter in school says, people just call out, and oftentimes the majority group members are speaking out or calling out over others? Is there a system to indicate a desire to comment, such as hand raising? And does the leader really actively engage with quiet voices? So when I'm leading a meeting, I sort of take a roster in my mind of like who's talking, who's not talking, and for those that are not speaking up, I want to do something to really try to actively engage those individuals in the conversation. And make sure that there's an opportunity for those quiet voices to speak up and provide their input. And so again, this is something that I think a lot of people will recognize from their own workplace. It's a common feature of some of our workplaces where people, just the group dynamic is just people speak out with whatever they want to say, and there's not a lot of hand raising, et cetera. So covered a lot of territory in 45 minutes here. So I want to leave you with two quotes to maybe inspire you along this journey. So one is actually from a member of the CAIRIBU network. This is Dr. Okanlami. He's in the UroEpi program at Michigan. In the wake of some of his efforts after George Floyd's murder, I read this comment that he said, which is, "The past may not be our fault, but the future will be." Right. So we all grow up in structures. I certainly have been advantaged by the privileges of my upbringing and the privilege of being a white male and the being at Duke for forever, as Dr. Pennison can tell you. And so I know the rules, and I know the hard rules and the soft rules, and I certainly have been advantaged to that. That is not necessarily my fault, that the structures were set up that way for me to succeed, but the future structures and how those impact people that are not from groups, not from demographics like me and don't have my same privileges will negatively impact those in the future. And so one of my missions is really to change things. And I think, as you can see from my network biopsy, my mentee network biopsy, I'm working actively to engage a very broad group of mentees. So, and finally, I'll leave you with this. Never doubt that a small group of thoughtful, committed people can change the world. Indeed, it is the only thing that ever has. So I thank you for joining today, and happy to address questions or any comments.